am an expert advisor in diversity and inclusion, and I've been a digital program manager, project manager, and relationship manager, all at Healthy London Partnerships. And Healthy London Partnerships, our mission is to make London the healthiest global city in the world. And we do that working for and delivering on work with our partners. Those include the GLA, London Councils, Public Health England, London Region, and NHS England and NHS Improvement, London Region 2. There's been a few projects that I've been involved in whilst on the programme. The first project was around open data, and it was very much focused on the comprehensive model of personalised care with a social prescribing element, but also other elements such as shared decision making and, I think, choice and control. So that piece of work, that platform was incubated by Healthy London Partnerships, and then that was released out. And then second, there was a piece of work that I was requested to do by our Chief Operating Officer, which was around understanding some of the digital activity taking place across the portfolio. And that involved using some of the techniques that we learned on the programme to understand some of the value proposition statements for the activity taking place, and to collate that and to get a sense of where things are, but also any alignment and opportunities for celebrating shared objectives by working together. So I think the current and really the most important project to me is where I am now, and that is the practical side of my academic research. And that involves a leadership case study, which I have made sure to include digital as a key feature. So the question that I'm looking into is influence, digital professional identity, and staff networks around health inequalities and inclusion. The network that I'm working with at the moment is a ethnic minority network. And so it's really important to me that we can bring in the digital enablers to help support networks deliver on their objectives. A big thank you to Ian Pettigrew for his breakout session on force field analysis. That was really a learning and light bulb point for me. So that's been great on the programme. I've also learned a lot from listening to others in my actual learning set, just understanding what their pain points were for their delivery and their projects. And there was also a really good session delivered by Atos. And some of that work has influenced definitely my practice. There are some other things that I learned, especially about myself, whilst a part of the fellowship. And that's all to do with some of the work that we did around our personal strengths. And I would say one of the other big things that was a learning point for me was looking at the ways that some colleagues are approaching data visualization, and that's definitely stuck with me and is influencing some of the work that I do internally, but also in my external roles as well. For me, the successes that I've seen in my project so far are really about influencing strategic thinking and planning, and thinking about that all around the digital enablers and the advances in innovation that can support those plans. A piece of work that I did quite recently with an internal staff equity network group was around celebrating their success, and also thinking about how things will pan out for the future. And I'm really pleased that I could bring in some of the insights gathered from the fellowship into that space and support my delivery of that session. I think two of the quotes that I remember from the day, I think one of them was actually around force field analysis that I mentioned earlier, and how much they appreciated bringing that into their space so that they could think around that model. And then I think another thing that was a success for me was really about being able to set out the benefits for participation using digital, and to work with the team to sort of understand how that fits in with their plans and monitoring their success. I think it's so important because health advocacy is also a role for us within the workforce, and especially when we think about sustainability of the workforce. And so I definitely still see a role for digital in supporting what those efforts are. So I think those are successes so far, but I'd definitely watch this space. My hopes for the future of the current research that I'm doing is that by using qualitative and quantitative data sources, that it will eventually be high impact learning. And I think it will be learning perhaps for other networks who are seeking to make positive changes. I think the future is really linked to some of the outputs that I mentioned and the recommendations around digital enablers. And so, although I know that technically the program is sort of coming to an end, I think being a part of the community means that I know there's somewhere that I can get support to continue on with these projects in different shapes or forms, or how they work out in terms of policy and strategy for the future. So one of my hopes for the wider community is to continue participating, and so I'm really pleased to be a part of the Digital Health Accelerator's interview panel for the upcoming cohort, just so that I can get a view of all the great innovation that's coming through, but also provide my critical friendly lens around making sure that we have impactful solutions, interventions, and aspirations digitally that encompass all of us. And so I'm definitely looking forward to supporting that piece of DHL's work.